How can we integrate considerations of gender, race, and income to combat stigma more comprehensively?
I think all that we will be talking about today in celebrating and commemorating the world's AIDS Day is what we're already doing. Okay, it's already one of the big steps to take. I think the factors you've mentioned in curbing stigmatization, gender, income, race. Okay. It's good that we've had the talk about what the stigma is and discrimination. I think it will also be important that we lay a premise by understanding the fact that these factors that we've mentioned actually play a role in the, should I use the word epidemiology of AIDS, meaning how the disease is distributed, okay? So as much as we want to try to reduce the stigma along these factor lines, we must not throw away the fact that the factor lines play a role, they contribute. Because I'm sure, which was even part of the things that was mentioned, we know that women are more diagnosed with HIV/AIDS than the male gender. We know that we also find it more in people with low socioeconomic status, maybe for reasons that are obvious. The fact that someone who is of a low socioeconomic status is less educated, less aware, do you understand? So can be at risk of all the risk factors that will contribute to the spread of AIDS. However, knowing that these factors play a role in the spread or increase the risk in people shouldn't mean that we should continue the stigma against such people. Okay, perhaps what we would need to do is to include those who are not among that factor, that group factor. I think Dr. Bamdele also mentioned something about males not wanting to come to clinics where for follow-up because they don't want to feel like they're part of the stigma. Perhaps that's one thing we should do. Okay, encourage the male gender to be part of the care or the follow-up. I'll give you an instance. I'm in the pediatrics specialty, and we see children who have HIV/AIDS. Thinking about it now, I don't think I can remember a time when a father has brought the child for follow-up, because we have to follow those children up until certain ages. I don't think I remember a father bringing the child. Yes, I don't think so. It's always the mother, all right? So maybe that's one thing we can do to incorporate the male gender. Most times, let's be honest. Again, I said let's speak to the fact. Most times when the mother comes, you find out that the mother was positive for HIV. Do you understand? Most times in those cases, the fathers are not positive. So again, that's a fact, all right? But it doesn't change the truth that the male gender should be involved. Perhaps if we're able to do that, then we can incorporate them better and reduce the stigma. In terms of race, sub-Saharan Africa is where we find commoner cases of HIV and AIDS. I think the Western world have been doing a lot to help with the stigma, truly, in terms of the AIDS that are not AIDS in terms of the disease right now, but AIDS, financial AIDS, donation of medications and all to help. But what does the Western media do in terms of communicating AIDS to the world? I don't know if you get what I'm saying. So if you are probably going to see pictures or videos to talk about AIDS, you probably will see African children, on the streets, like Dr. Bamdele said, looking like walking bones. Okay, so what is the media doing in curbing the stigma? Are they painting a consistent picture that is only Africans that are affected? Yes, do you understand? Forming a stereotype. So perhaps that can be one way where we can also include people of other race who are not the most common affected race. They are affected as well, but they are not the most common. Maybe that's a way they can also help with curbing the stigma. Income, maybe people who have more money should help people who have less money, if you think about it that way. Or there's this thing that happens normally where the fact that I know that you are richer than me makes me just feel less wanted, inferior. Or so we can walk into the same room and I see people have certain things. Maybe they have some AirPods and they use some type of phone. I stay in a different place. Okay, yeah. So when I was doing my internship, I met a mother who I never knew had HIV/AIDS, and she had IVF conception and delivered twins in the hospital. This hospital, you would never know. She was healthy looking, very fine. So where I'm going to with the story is that the money was there. You understand? So the money was there. So maybe people who have HIV/AIDS and are of the low socioeconomic class would be marginalized if they are in the same room with someone else who also has HIV/AIDS and is of the higher economic class. Do you understand? So perhaps we should, again, I've said that it doesn't change the fact that people of lower economic class are the higher number that have HIV or AIDS, but the stigma should not remain on them. You understand my point? So if I should summarize all that we have said, I think we can incorporate this by including the male gender more in follow-up cases, in clinic visits, encourage the Western world to do more of the storytelling in a proper way, or at least in a way that doesn't stigmatize the sub-Saharan African race. And of course, people with higher socioeconomic status should also do their best. Yeah.
Thank you so much for that. So if I'm to put one word to encompass everything he said, I think I'll say inclusivity will play a major factor. So the myth we're debunking with this question is AIDS only affects certain groups. Can you debunk that myth quickly for us?
Okay, I think we just said that. Yeah, AIDS, and it's part of what we discussed about stigma. It's the attitude and the belief that it's only a group of people that AIDS affects. That's not true. That's not true. Again, maybe we should paint a picture of what the stigma looks like, okay? It's a chronic disease, we know, right? AIDS is a chronic disease. So why do we feel differently when someone walks into the room and says that I have diabetes or I have hypertension? It doesn't look so bad, but then someone else comes into the room and says, I have HIV/AIDS. And then everybody, yes, everybody feels that way. So even though we are talking about this, if we think about it internally, I hope we still don't have that level of stigmatization in our own minds. What first comes to your mind when someone says they have HIV/AIDS? Do you first think about them as some immoral individuals? What if they had just been perfect and something happened, like Dr. Bamdele said, the child just had the blood transfusion and then AIDS was transmitted? Do you understand? Or the baby was just given birth to a mother and by a mother who had AIDS. Okay, so maybe we have to do a recalibration of our minds and don't think that the first thing that must have happened to this person is that they have been promiscuous. Perhaps if we can do that and find other reasons first and probably make the sexual mode of transmission the last option, maybe we would be more acceptant of them. I think so.
For that. Okay, so my next question, how can doctors and communities like ourselves help people with AIDS mentally?
Okay. How can doctors and people living around help people with AIDS? Okay. This question reminds me of one, should I call it a story or an encounter that I had when I was doing a program in Port Harcourt. And the person described something and said, when there are clinics for people that come for follow-up with HIV or AIDS, it looks like the clinics are specific. So you know that you are coming on this day, going to this place, and everybody who comes on this day and goes to this place must be someone that has HIV or AIDS. Do you understand my point? So that way, there's already the fear, maybe the self-stigma to the people who have AIDS themselves, okay? Meanwhile, if you have headache, if you have cough or catarrh, you can walk to a clinic at any time during any day, and nobody necessarily has to know that why you're coming to the hospital is because you have, yes, cough or catarrh. Perhaps that's something the health system can do. I know that will be resource tasking because what diarrhea they might come with, more than the tuberculosis they might come with, more than the skin lesions they might come with. Do you understand? More than the disease itself in terms of the body, and begin to think about the disease and how it affects their mind. Okay, because we know that beyond any disease condition that would have a chronic effect on someone, talk cancer, talk hypertension, talk diabetes, will take a toll on the mental health of the person, regardless of how strong they might be mentally, how they might be able to deal with it. So perhaps we need to interrogate or interact with that their psychosocial well-being. So how are you feeling today? Beyond, are you using your drug? How many days have you missed? Do you understand? Yes. And maybe find out how they are feeling, how they are coping, wherever they are working, in church, and maybe be able to talk to those things. And also what Dr. Bamdele has also mentioned, the stigma. Maybe doctors too should do better in not stigmatizing such patients, okay? Not making them feel whether by mistake, accident. When I mean accident, so I can walk into a room now where someone who has AIDS is already there. Maybe someone else is managing that patient, and I'm taking over. And in the takeover, and someone says, she has AIDS, and I don't know the patient is watching me, but my reaction mistakenly makes the patient feel that he has been told, he has been informed. Did you understand my point? Yes. Maybe we can do something about that as well. Now, concerning people, I also allude to Dr. Bamdele's previous delivery, that there's a lot we can do to help our friends. Okay, that scenario he painted was very important, because sometimes we can talk about these things, and then when they become practical, it can become scary. When he said, beyond telling that your friend that it won't be transmitted through his food, go and eat the food. I cringed a little when I heard that, but those are the things we actually need to do. Will you be okay to go and eat the food? Are you strong enough in your mind to go and eat the food? Do you understand? Because I think when he mentioned that, I had a thought in maybe a rethought or something like that, that, okay, that's true. This disease is not a poison. It's not something like in Nollywood movies, you pour into the food and then you eat the food and you get it, okay? So, yes, you can actually eat the food and you are fine, okay? But I think beyond that, maybe we need to listen more, okay? Actually came about something that friends and family members of people living with HIV, you might need to listen. And listening can mean different things depending on what point you are meeting them, what you need to listen, how you need to listen to someone who has just been diagnosed of the disease. It might be different from someone who probably had already known they had the disease for a while, and now they're just battling with maybe the psychosocial impact of it, or whether they want to use medications. Do you understand? But perhaps listening should include allowing them to prompt you to what you should listen about. Do you understand? Let the conversation flow, let it be prompted by them. You should be able to be willing to still do things you do with them before they were diagnosed. Do you understand? And let them feel that there's been nothing different about them before and after the diagnosis. We also need to learn. This now is not necessarily because you're a health person. If you have people around you that have HIV or AIDS, you need to learn about the disease, because the knowledge you have is what can empower you to know what to do, what not to do, and how to help them. Imagine someone telling you about their disease condition. I don't even know anything about it. So what do you want to say? Did you get my point? And perhaps we also need to encourage them. We have known by science that if the disease condition can be detected early enough, if medications can be started early enough, patients can live long, healthy lives. Dr. Bamdele mentioned that the average lifespan is 52 years from after diagnosis. And he said, if you are 30 and you diagnosed you at 30, when you reach 80-something, you have done your best. Yeah, you have done your best in life. So if we have that knowledge, we can encourage them, get treatment early enough, and let them know that they can live healthy lives afterward. And maybe lastly, I'll say that just continue to offer the support. Because you see, people can immediately live with the reality of something for the first 1 week, for the first 2 weeks, maybe for the first 1 month. A different reality hits them when it's about 3 months, 5 months down the line, and they begin to say that, oh, I mean, this thing is real. I have to swallow pills every day. So that support, that continuous support will be important. So if I should recap that question, I'll say there's a whole lot doctors should do in terms of speaking to the psychosocial well-being of the patients beyond just the disease condition itself, and maybe individuals too, living around people should learn, should listen, should encourage, especially in terms of medication and adherence to whatever treatment they are on, and should support. I think those things will go a long way.
Can we give me a round of applause for that? Okay, so I think for the professionals, I mean, when you seek help, the first thing is professional advice. Sorry? Okay. But for us, the community, we could see them first as people rather than patients that are diagnosed with any issues. Like, these people are first people before they are HIV positive patients. So let's do better to talk to these people, converse with them as people first than any other thing. Okay, so I think the myth for this one has also been answered. But it says AIDS is a punishment for personal acts. I think I myself can answer that it's not punishment, it's circumstantial. A few times or a couple times it could be from, but it is not punishment. Okay, so the next question, can you share innovative approaches used to shift perceptions and correct misunderstanding about AIDS?
Okay. Yeah. Let me say this is one innovative way, okay, having these conversations. I'm trying to relate this with what we have seen in times past, okay? I'm trying to remember what sickle cell used to look like and how people used to feel that you were just, something was just wrong with you if you had sickle cell disease. But I think that is changing, okay? Why? Why is it changing? Okay? Maybe we did something right, okay, at a point. Maybe we communicated about it more. Maybe we did a lot more awareness campaign. Maybe people started talking about if you are this, don't marry this. If you are this, don't marry this. If you are this, so at least in the most basic level, people know that, okay, if I'm this genotype, I should not marry this genotype, even if it's that basic. Do you understand? It probably did something. Maybe even went as nice as Twitter people talking about first date question. What's your genotype? Do you understand? As simple as that is, it's informing. As simple as that is. So, if you talk about innovative, I'm guessing you are trying to say what things should we do maybe differently or more creatively. Maybe we'll have to go back to the root problems. Okay, where do we need to solve certain issues? I think the religious setting is a very huge one. Okay, the fact that we know, especially in a setting like Nigeria, what the influence of religious leaders is on people. It is huge. It is massive. We all know that. So maybe if we have recurring awareness and campaign about the disease, because the truth is that not to slight beliefs or faith, sometimes whatever we believe is, once is religious, it's almost impossible to change. Do you understand my point? So maybe religious leaders need to first learn themselves about what this condition is and be able to drive campaigns concerning them. I guess that would be helpful. I'm also thinking about the media. How many of our influencers drive conversations through their acts on HIV and AIDS? Maybe we need them to do more as well. Okay, they run skits. They run. They do a lot of skits, and they do skits many times now. They do skits in relation to what is trending, and somehow people get initiatives, get mindsets from those things. So maybe the media, the entertainment industry can do better. Okay, if I remember what HIV used to be like when I was growing up in Nollywoods and stuff. Of course, if you want to paint a picture of somebody who is, if I should think of one off the top of my head, I'll first say that a lot is already being done, especially in trying to bring care to people in places closer to them. Okay, now we might need community leaders to actually consider activities that they can do to make these people feel inclusive. Do you understand? Yes. And maybe avoid activities that make them feel abandoned or isolated. Okay? So, could we actually have activities where, again, I'm trying to be careful about the thoughts in my head right now because you also want to be sensitive to them, okay, concerning what they have. But at the same time, maybe we still just need to continue awareness. Maybe that's also very important, to continue awareness. And if you talk about communities, I'm sure the communities will not just be limited to a town where people live. It may also include groups of people wherever they may be, okay? Communities might be communities in workplace, communities in training facilities, communities in schools, and all of that. How can we help too? Okay, I'll think about the fact that if I know, for instance, as a healthcare worker, that there are strategies in place to help me prevent me from getting HIV, probably I would be willing to associate more with someone else who I know that has HIV in the workplace. And perhaps that can work for every other workplace as well, which I might not be able to think off my head because I'm not there. In schools, what do we teach people? Even from right when you were little, do we let people know that there's this disease condition and it could be transmitted in such ways, and people that have disease conditions are not bad people necessarily, and you can support them in certain ways? Maybe we need to do a lot also in the communities of trainings and education. I'm not sure I have more specific things that can be done in towns, apart from leaders, town leaders now, actually taking innovative steps to make such people feel inclusive, okay? And I know that there are a lot of cultural stigmatization, that's true, okay? Because we are in the more urban areas, so we probably don't see that. But people where they live in closed niches would have a lot of stigmatization going on. So if those practical steps can be taken to actually create awareness amongst those small groups and let people know that these are things you can do that can help the people living around you, maybe that would be helpful.
Just give me a round of applause. Okay, so I think for communities too, you don't need to break a bank to conduct a campaign. So when you talk about limited resources, it doesn't have to be so expensive for you to raise awareness. It can even cost you nothing to do these things. And I think you mentioned something about religious leaders having so much influence in this part of the country. I mean, if these religious leaders also make it a point of duty to raise awareness, the same way we trust them with everything that they say, I think we'll take it with the same light, and that could really help.
They can even raise funds. Religious leaders know how to raise funds.
Yeah, so thank you once again. The Q&A session has officially come to its end. I hope we all learned one or two. All right, so thank you.